So your time starts now. Your time is up, doctor.
Okay. Hello, I am Shanti, one of the registered, and you?
I'm John, doctor. I have recently joined the department, doctor.
Okay, so John, how is the department?
Yeah, Shanti, it's quite good. I'm learning, getting oriented to the department.
Mhm. And I can see that you want to learn regarding the this labor care guide. Any specific reasons for that?
Uh, yes, actually, I saw one of the midwife was feeling this particular labor care guide, and I noticed that it looks like a partogram, but there was little difference. Also, I couldn't understand what exactly is this. But midwife was monitoring the progress, so I just wanted to know details because next week onwards we'll be having the rota emergency duties and we'll be monitoring the patient. So good. I should know. I feel that is what I want to know.
Yeah, John, it is very good that you have chosen this topic because this is a very important thing, especially if you are working in the labor ward. And also, each healthcare worker who is working should be able to fill this program and able to interact with regarding this. And any idea regarding this program before or first time
So,
you are seeing?
yeah, partogram I have seen, but this was little different from that. Means partogram is used for the monitoring the progress of the labor. That is
Yes,
what I know. And
yes,
midwife was using this for the monitoring. So I wanted to know
yes.
this.
Yeah. Yeah, so John, actually, there is this is a type of pathogram actually, and then before we were using the WHO pathogram, and now it is the new guideline that is the new modified by the WHO, that is a labor care guide. So today, I'm happy that you want to learn, and so today, of course, I will be explaining you regarding all the details. What is the difference between the old one and the new one, and what is the importance, and I will help you to learn all the steps and what is the importance of this labor care guide as well. So in between, if you have any questions, you can ask me, and at the end, just give me the feedback how will be the session, and at the end, I will also give you some reading materials, some RCOG, videos, and also some articles, so that you can learn from that. Is that we fine, John?
Yes, yes, yes. That's
Yes.
okay.
Yeah, so John, the importance of this labor care guide is that so this is one of the like a legal document which will help us during the progress of labor, and also in case of any complaint by the patient, so it will act as the as the one of the proof. Other thing is that also it reduces it monitors progress of labor and reduces unnecessary interventions, and also it reduces complications for the mother, like in terms of postpartum hemorrhage, in terms of sepsis for the mother, and for the baby, any asphyxia, any fetal death, and also it will also affect the fetal well-being. And so these are the few importance of this labor care guide. The first of all, it is important to know why the WHO pathogram is changed to this labor care guide. Okay,
Yeah.
okay, John. So actually, the previously WHO care was also seven component. Even new one also is a seven component. But thing is that previously we have got it was started in 1990. But there was like fixed centimeter in the cervical dilatation, 1 centimeter per hour, and there is no evidence that this is improving the maternal outcome. So because of that, they want to change this, and now there is the active labor started 5 centimeter, and the previous weight was 4 centimeter. Okay, and there are some differentiation as well. The first is that there is maternal support. Okay, so that part was not there in previously, and shared decision is not there, and also here there is the strength of uterine contraction is not there, and thing is that previously it was like 1 centimeter per hour, and then it was at 4 centimeter, and then there is action light and alert line. and there is no second stage monitoring. But here there is second stage monitoring, and also the each centimeter of cervical dilatation there is a
Make
fixed
use of this.
fixed yeah, yeah. So this is a fixed duration. So for the, at least for 5 centimeter we have to wait for 6 hours, and for the 6 centimeter we can wait for 5 hours, for example. And so let us speak detail in this section. So section one. So we have to um, give all the data for the patient, like what is the name, what is the NFS number, what is the parity, any high risk, it is spontaneous onset of labor, and also any risk factors, and like all timing of admission we have to write down. Okay, so John, how many section we have? Can you tell me?
Total, there are seven sections, doctor,
Yes,
and
yes,
you also mentioned that the uterine contractions, the strength, and the alert line, action line. That was the
yes,
difference between the new one and the old one, and
yeah.
even
So
the 5 centimeter charting,
yeah, yeah,
the new. That
yes.
is what you mentioned.
Yeah, so John, now you are doing very well and you are a very quick learner. And so coming to the second one we have got the support. So for in that we have to see the what is the whether patient is having any birth attendant, so whether she's how is the pain management is there, whether she's taking oral fluid, and what is the posture, whether she is mobile or whether she is supine. So these are the second section. And then third one again we have got the for the baby what is the fetal heart, so what is a normal fetal heart? Then again, we have to see whether there is any like there is clear or any meconium stain, the taproot or molding is there. So this is the third one. And fourth one again for the maternal component. Again, we have got maternal blood pressure, systolic, diastolic. Then again, we have to go for the heart rate. Yeah. Then then after the fifth one, we have to go for the uterine contraction. Yeah, where is the fourth one? Fourth one is up, no? Yeah, yeah. So this is again the maternal. For the maternal, we said okay. So next one, the fifth one. Fifth one again, we have got the uterine contractions. Here, you can see 1 second. Very small. Yes. Yeah. So here labor progress again 5 centimeter, and then as I said, so every centimeter per hour there is a different time limit is there. So coming to the below, there is also descent of the this baby's head. And section C 6, there is again any medications we are giving, like IV fluid or oxytocin, any other medications we are giving has to be noted down. And section 7 is very important. Every 4 hours we have to assess the patient, and we have to involve the patient and also have got the partner. So regarding the findings and also what is the action plan we are taking, we have to tell them, and also said decision has to be taken. And at the end, we have to put our signature. The person who is doing the evaluation of the patient has to sign. So the important thing is that whenever any section, if there is any abnormalities is found, we have to circle in the red line, and it will be the alert. So suppose, for example, if there is no birth attendance, so we have to write there is no. So we have to circle there. And if there is caput is there 3+, so we have to circle it. So this will give us the alert action. So we need to improve. So in case of any delay, we have to make sure that so delay can be like in the contraction. It can be we have to assess the pelvis, and also you have to assess the contraction. So in that every 4 hours you have to assess, and then further decision has to be taken. John, any questions so far?
No, no. Actually, I got what you said that this is a very good way of monitoring, and there are seven sections of this chart. And the last one which you mentioned, I like that it is a shared decision making,
Yes.
because we are involving the patient also, we are and their partner also, and rest of the sections also I understood. Yeah.
So yeah, so anytime next time if you have you are in labor ward duty, so we can fill it together. So you can try to fill, and if any problem, always I am here to help you. and I will give you some reading material as well. So how was the session? Anything else you want me to explain?
No, it will be better if I feel this together in the labor ward with the patient, and that also we can try. That's the thing.
So yeah, so I'll be happy to do that. So thank you for speaking to me, and have a lovely day.
Yeah, thank you, Dr. Shanti. The time is exact
Yes.
10 minutes. Exact 10 minutes. Okay.
But actually, this one they were giving in between like some patient like that. No, so I was thinking whether to say, what to say like that. I
Like
mean any example of patient, we have to feel that way.
yeah, yeah. Here,
So yeah,
there are two, three versions of this. This
yeah,
is actually the simplest version in which you are
yeah,
going to
yeah.
describe. Okay.
Hmm.
And this description sometimes, this in examination, your structured approach will be very well assessed in this simple task, whether you are covering all the aspects or not. Sometimes when the task is complicated, no, then
Hmm.
you are likely to go here and there, but
Yeah.
here you have to be perfect. That structuredness
Yes.
will be very well assessed. Okay, so it's
Yes.
always better. This was a very good performance. Always better to discuss about all 7 sections and difference between the partogram, then partogram versus labor care guide. There are two ways of to do it. One, you can mention about the differences first, or you describe the partogram and simultaneously you mention about the differences.
Mhm.
Okay, and
Mm.
generally asking the difference is a part of this particular task. Okay, so we have to be very, very thorough. Okay, now once about the strength of the uterine contraction you mentioned. Second, there is no action line, there is no alert line that you mentioned. Third
Yes.
thing, shared decision making also you mentioned. Then the
Mm.
this has got a second stage
Yes.
which also charted, which is not there in the previous one. Okay, so
Mm.
these are 4 5 things actually which you should mention, but there was no talk regarding the second stage, so that is why I was again and again shifting between the two. Okay, I wanted you to talk something about the monitoring of the second stage. Then
Mm.
section 1 is very simple. So these are the details which we need to
Yeah.
fill, which name, parity, and all. And
Mm.
okay, section 1 is very simple. So
Yes.
always immediately ask the role player about the section. Okay,
Yes.
because they will read it. What exactly
Yeah.
you have to read, and they have to read. Okay.
Yes.
Second,
Mm.
describe about the alert column and the this particular alert column. Okay, and the timeline. This is x-axis and this is y-axis. X-axis is a timeline. Y-axis is a alert column. Okay,
Mm.
okay, and here there are normal parameter. Here there are normal values which are given. Any deviation will be encircled.
Yes.
Okay, and second thing is that this particular all the encircled we have to see in all sections, and then we have to make a decision, the
Mm.
plan at the end when you say no. So
Mm.
what you are going to encircle, that you need to mention. If the
Yes.
companion is there, you will mention why. If it is
Yes.
not there, if there is n, you will encircle. So always say,
Yes.
okay, when
Mm.
will you encircle? If there is no companion,
Yes.
then the role player will say yes. So
Mm.
ask a simple thing here, one. Okay, so
Yeah.
in
Mm.
each you can ask at least out of 2 sections, in you should ask one question. So for 7, at least 3 to 4 questions will be there. Okay, so
Mm.
the question will be, where will you encircle? Here, where will you encircle? Okay, caput 3 plus, and
Mm.
this fetal position. Okay, then amniotic fluid, if it is meconium stain or blood stain, that we are going to encircle. Okay, so these are the
Yeah.
points you should say. Okay, then section rest of the sections you have described. Even this difference, previously 1 centimeter per hour, and now there is no fixed rate. Okay, that is why they have given this particular time. Okay, at 5
Mm.
centimeter, more than 2 or equal to 2 hours, then at sorry, at 5 centimeter more than 6 hours, at 9 centimeter more than or equal to 2 hours. That is what the time limit which they have given. Here the about the oxytocin. Second thing is that medicine. The patient may be taking some, she may be a case of preeclampsia, she may be taking other associated medicine like she may be a case of epilepsy, or so any medication which she is receiving, that should be charted over here. Okay, so that you should mention. Then the fluids. Okay, then assessment you have mentioned. Okay, and actually assessment is not 4 hourly. Assessment is always 1 hourly. Per vaginal examination is 4 hours. Okay, and here we will formulate the plan of action. Okay, we'll write the initials of the whosoever is assessing. Okay? So that is about the paper care guide. This was a well performed station. I'll say this is a pass station.